Why is a calcitonin blood test used for MTC detection? Imagine a tiny alarm bell inside your body that signals when something is wrong with your thyroid. That alarm bell is the hormone calcitonin, which is made specifically by cells in the thyroid called C cells. When these cells become cancerous, forming what is known as medullary thyroid cancer, they start producing a lot more calcitonin than usual. This is why measuring calcitonin levels in the blood is so helpful. Elevated levels of calcitonin can be a clear sign that medullary thyroid cancer might be present or developing. In healthy people, calcitonin levels are very low, almost indetectable. But if a person has medullary thyroid cancer, the tumor cells produce excess calcitonin, causing blood levels to rise significantly. This makes the calcitonin blood test a very sensitive and specific tool for detecting this type of thyroid cancer. Doctors often use it to help diagnose MTC, especially when levels are more than 20 times higher than normal. However, it's important to remember that a normal or low calcitonin level doesn't completely rule out the disease, because some cases, especially inherited ones, might not produce high calcitonin levels. The test is also useful for screening people who are at higher risk, such as family members of patients with inherited forms of MTC, including those with multiple endocrine neoplasia type 2. Detecting elevated calcitonin early can lead to earlier treatment and better outcomes. After treatment, like surgery to remove the thyroid and tumor, doctors monitor calcitonin levels to see if they drop to very low or indetectable levels. If levels stay high or start rising again, it could mean some cancer cells are still there or the cancer has come back, which helps guide further treatment decisions. Preoperative calcitonin levels can also give clues about how advanced the cancer might be. Higher levels before surgery often mean the cancer has spread to nearby lymph nodes or other parts of the body. This information helps surgeons plan how extensive the operation should be and gives an idea of the patient's prognosis. While calcitonin is a very specific marker for medullary thyroid cancer, other conditions like certain neuroendocrine tumors or hypercalcemia can sometimes cause elevated calcitonin levels. That's why doctors interpret these results alongside imaging tests and biopsies to get the full picture. In rare cases, some medullary thyroid cancers may not produce enough calcitonin to be detected, which can make diagnosis more challenging. In those situations, additional markers and tissue analysis are necessary. Overall, the calcitonin blood test is a vital part of diagnosing, assessing risk, monitoring treatment, and screening family members for medullary thyroid cancer. It's a powerful tool because it directly reflects the activity of the C cells that give rise to this cancer, helping doctors catch the disease early and plan the best course of action. If you or someone you know is concerned about thyroid health, always consult a healthcare professional for personalized advice and testing options.